Hi, everyone. My name is Ambrosia Lopez, and I'm the Director of Mission Programs for Susan G. Komen. I've been at Komen for the past 10 years, and I'm just very grateful that you're joining us today. I wish we could be in person so it could be more of a conversation, but today's session will be more of a presentation, so I will have a PowerPoint that I will be covering certain aspects of breast cancer and some breast self-awareness messaging. Just want to put a caption that I am not a doctor, so please note that any personal questions or any health related questions, you should talk to your providers. And this is more of an educational forum. I might add some of my personal anecdotes, doing this work for 10 years and really working with the community of what I have observed and the different interventions that we've tested throughout the years. But please hold your questions till the end. You can start putting in the chat box if you want. I just want to make sure that I might cover it during the conversation. So at the end, we could have a dialogue. But just remember, this is more of a training style with key messaging that, is from our Komen Foundation. So welcome. And I think I'm gonna get started now, just to respect everyone's time. But thank you for being here today. All right, so our agenda for today is that we will be introducing you to Susan G. Komen at a national and local level. We'll be covering breast cancer information, some breast cancer statistics. What is breast cancer? How does it start? How does it metastasize? Some breast self-awareness messages and recommendations, diagnosis, treatment, clinical trials, support, and resources. So those are some of the things that we will try to accomplish this hour. And like I said, please hold your questions till the end and we will try to address them. Okay, so our mission is to save lives by meeting the most critical needs in our communities and investing in breakthrough research to prevent and cure breast cancer. So here I'm very proud of some of the work we are doing with mobile mammography and bringing it to our local supermarkets and targeted areas where we find very vulnerable women who need a screening mammogram. And our big, bold goal is to reduce the current number of breast cancer deaths in the US by 50% by 2026. And with that, we need your help as advocates, as navigators, as doctors and providers to really make our community aware and link them to resources. And Susan G. Komen, we were founded by Nancy Brinker, who promised her dying sister, Susan G. Komen, that she would do everything in her power to end breast cancer forever. So we started in 1982. Here locally in Orange County, we'll be celebrating our 30th year. And that promise really launched a mobile movement, a worldwide movement. And we're very excited to be part of that here locally in Orange County. And in Orange County, just to let you know how we kind of figure out what is the state of breast cancer locally. So we do a study every 5 years, which is our community profile, where we do a qualitative, quantitative look at cancer incidence, mortality, to figure out which are the communities that are dying at disproportionate rates, and really guiding our, everything from what kind of programming we do, what kind of policy implementations. And our profile is coming to an end this year, so we'll be working on further statistics to share with you. But what was very alarming to us is that every day in Orange County, 5 women are diagnosed with breast cancer and 1 woman dies of the disease. And the communities that are dying at very unproportionate ways because of higher breast cancer incidence or late stage diagnosis and mortality. So let me clarify incidence. Incidence is when it happens. Usually a lot of women don't have a difference in the incidence, but the concern is when they're diagnosed, so the stage of diagnosis and the mortality rates. So in Orange County, the women who are dying at disproportionate rates are African American, Asian Pacific Islanders, Hispanic Latino women, and women who are 65 and older, regardless of your ethnicity or your race. And what we found also that is alarming is that the incidence rate here in our county is higher than our state average. So we are, 123.5 out of 100,000 females versus 125 per 100,000 females in the state average. Okay, and some of the areas of focus at a national level and also here locally is that we do have 4 pillars, we call them, and these are When you think of breast cancer, we need to think about it and approach it in all different ways in order to really make an impact. And that's what makes Komen a little different than a lot of the foundations, because we do focus on all these areas. And we're very part of our research portfolio and the investment that we've had throughout the years. And here locally, for the past 2 years, we've held the Metastatic Breast Cancer Conference, and we're very proud of the support we have gotten from our partners and the community, and really raising a voice and making sure that there are clinical trials here locally that people can participate in, and that we always advocate for those research dollars in order to find a cure. The other one is also CARE. So our affiliate this past year funded 7 breast cancer programs here locally, so we can make sure that there's a safety net for women who are uninsured, underinsured, who need some type of monetary assistance, or who might need that mental health support. And then as a community, we come together maybe during our walk. Komen is kind of known as a convener, so we bring people together to advocate for our breast cancer survivors, those living with MBC, and also to figure out solutions. How can we address the needs of our local community? And action. So action really refers to our advocacy, and really being the voice of those 3.8 million survivors that we have, at a local, state, and federal level, and making sure that we preserve and expand the breast health safety net, and that we also make sure that the patient rights are heard and that they're represented at all those different levels. Okay. And when we think about breast cancer and how does it compare to other cancers at a national rate, what we find is that aside from skin cancer, breast cancer is the most frequently diagnosed cancer in women. More women in the US are diagnosed with breast cancer than any other type of cancer, and breast cancer is second only to lung cancer in deaths. So in 2020, we expect that more than 42,000 people in the US will die from breast cancer. As you can see, we do have alarming rates, and just remember that men also get breast cancer, but at different rates. And what we're very proud of is that the mortality rate continues to decline, a trend that started in the 1990s. Overall, the breast cancer mortality rate declined 40% from 1989 to 2017 due to improvements in early detection and treatment. Okay, and 1 in 8 women will be diagnosed with breast cancer in their lifetime. And the thing about breast cancer, it doesn't discriminate. It doesn't discriminate race, ethnicity, color, age, gender. So it can impact anyone or any of your loved ones. That's why we have to be committed to really finding solutions and treatments and advances that are going to improve those statistics, and really look at some of the health outcomes for our different communities. And like we said, there's over 3.8 million breast cancer survivors and people living with breast cancer in the US today. And like the Office of Cancer Survivorship and the NCI, we consider survivorship to begin when people hear the words, "You have breast cancer." A note, about 3.8 million survivors. Some survivors are in treatment, some are recently diagnosed, some out of treatment, some are 20-year survivors from diagnosis, and some are doing well and some are not. And we also have our metastatic community that is living with breast cancer currently. Okay. So what is breast cancer? And breast cancer is a disease where the breast tissue divide and grow without normal controls. Cells are the building blocks of every organ in the body. Every day, cells in the body divide, grow, and die in very controlled and orderly process. But when the cells grow out of control, this uncontrolled growth of cells forms a mass or a lump called a tumor. Tumors are either benign or malignant. Benign tumors are not cancerous. When these tumors are removed, they typically do not reappear. Removing a benign tumor is usually the only treatment required. The cells of a benign tumor do not spread to other parts of the body or invade neighboring tissue. However, malignant tumors are cancerous tumors. Malignant tumor cells can invade neighboring tissue in a process called invasion or infiltration. A malignant tumor that develops in the breast is called breast cancer. Along with the ability to invade surrounding tissue comes the ability of cells to break away from the primary tumor in the breast and spread to other parts of the body by traveling through your bloodstream and lymphatic system. So I basically see them as entering the freeway to your body. This process is called metastasis. When a malignant breast cancer appears in a new location, they again begin to divide and grow out of control as they form another tumor. Even though the new tumor is growing in another part of your body, it is still called breast cancer. The most common organs of breast cancer metastasis are the bone, the liver, the lung, and the brain. It is metastasis that almost kills that causes most of the deaths from breast cancer. All right, so now we're gonna go to basic science and a lot of the physiology. So we wanna know a little bit more about the anatomy and the physiology of the breast, so you could kind of understand some of the information that I will relay later in the presentation about the different types of breast cancer and some of the screening recommendations. So if you see, the breasts are made primarily of fat and breast tissue. In this image, the yellow area represents fat. The main chest muscle, the pectoral muscle, is found behind the breast and in front of the ribs of the chest wall. The muscle lies on top of the rib cage, and you can see the ribs here. Breast tissue is a complex network of lobules, about 1 million, lobes, 15 or so, and ducts, 5 to 7 systems, in a pattern resembling bunches of grapes on their stems. This is the functional part of the breast. The lobules are spherical shaped sacs that produce milk. The milk is collected in the lobes, and the ducts carry the milk from the lobes to the nipple opening when a woman is breastfeeding. And one key thing to remember is that our breasts change over time. So definitely while we're aging, there's different phases of menopause, premenopause that we need to be aware. So what causes breast cancer? The short answer is that we really don't know, but what we do know is that it occurs as a result of gene mutations. Okay? So every cell in the body contains nearly 20,000 genes. Genes are the blueprints to the body. They determine the color of a person's eyes and the hair color, if it's curly or straight. They contain the blueprints to make proteins, which are important in cell regulation. And sometimes the genes don't work like they should. This is due to an error in one or more of the genes called a mutation. Mutations may be spontaneous or inherited. Spontaneous mutations are those that may occur during the course of a person's life. We don't know what causes these mutations. If they occur due to a person's lifestyle, molecular changes inside the body, or exposure to environmental toxins. Or even if we understood what causes them, if we could do anything to prevent them. Most breast cancers is due to spontaneous gene mutations. Inherited mutations are those that a person is born with. A defective gene that comes from one of your parents, either your mother or your father, and it's passed to the child. A number of inherited mutations have been linked to breast cancer, including the mutations known as the BRCA1 or BRCA, and BRCA2, P53, ATM, PTN, and MACC. Although these mutations greatly increase the risk of developing breast cancer, they are rare. And in the general population, they only occurs 1 in 400 people get a mutation. So they only account for 5 to 10% of all breast cancers in the US. Remember that statistics, 5 to 10% of genetic mutations are caused by the BRCA mutations. Okay, so sometimes we hear people telling their stories. Remember that all women have these genes when they work normally. They work as tumor suppressors. But some women have inherited a mutated form of one of those genes. Inheriting a mutated form of BRCA1 or BRCA2 increases a woman's risk of breast or ovarian cancer. So it does impact both areas. And now, one of our biggest platforms that, we really stand by is early detection, because the earlier we find the cancer, the better treatment options there are for surviving this cancer. So breast cancer mortality, like we said earlier, is declining by 40%. And we hope that by investing and having these great researchers that we do get closer to finding a treatment for breast cancer or a way to prevent breast cancer. So our organization stands by our breast self-awareness messages. So these are the key things that if you're doing a presentation in the community and you only have a limited time, these are the things that you could focus on to really make people aware of what are their risk factors and what they should know about their breasts in order to have the conversation with their providers. Okay, so first of all, we want to know our risk. And the thing about risk is that you have to think that, a lot of families are reluctant to talk about breast cancer or any cancer, women's issues. So what happens is that if we don't talk about it, if we don't know our history, how do we know if it's going to impact our risk of getting breast cancer? And I'll tell you a personal anecdote. My family growing up thought that my grandma died of witchcraft. So I was like, what? She died of witchcraft? But when they describe a lot of the symptoms she had, it sounds like breast cancer. But how would I know? So I won't even know what the risk is for my family because it wasn't something we talked about, or there was these cultural interpretations of disease. And, and my family comes from Mexico. So that's kind of one of the cultural things that I learned out through my career. So now I'm trying to figure out what is my history? What can I do to really acknowledge what are my current risk factors? Another thing that we recommend is that you talk to your doctor. What is your personal risk? And, studies show that most women overestimate the risk of breast cancer. The information from your family history and your own personal history can help your provider understand your personal risk. So you need to have that information. And right now there's really neat risk assessment tools that you can look up online, like the Gale model. And they could give you an average risk. So, are you at average risk? Are you at high risk? And that really does impact your screening modalities moving forward. So risk factors, what are risk factors? So currently, we do not know what causes breast cancer to develop in a certain person at a certain time, and we don't know how to prevent it. We are learning more every year about risks associated with breast cancer, and we will be talking about some of the risk and risk reduction behaviors in a few moments. Risk factors are not the cause of breast cancer. Remember, I just said that we don't know what causes it. Researchers have, however, identified a number of factors that increase a woman's chances of getting breast cancer. It is likely a combination of risk factors, some still unknown, that together may make the cells turn cancerous. But why? Why a certain combination of factors may cause cancer in one person and not the other is still unclear to us. Some women have many risk factors but never get breast cancer. Having several risk factors for breast cancer does not mean that a woman will get breast cancer. It means that her chances of getting the disease are higher than women who have fewer risks. Even if a woman does not have any of the identified risk factors, she can still develop the disease. Many women with breast cancer do not have any known risk factors aside from being female. The two most important risk factors for breast cancer are being female and getting older. And unfortunately, even though with plastic surgery and other things, we can't really control those factors. But however, there are some lifestyle choices that we can make to reduce our risk. So these are some of the most common risk factors that have been studied over time. So sometimes I'm kind of, when I do presentations in the community now that I'm, virtually speaking to all of you, I'm kind of reluctant to talk about it because a lot of people start counting the risk factors. They do a mental list and they kind of figure out, am I at high risk or low risk? So as I have mentioned before, all women are at risk of not having identifiable, sorry, all women are at risk of not having some identifiable factors. I think, let me give you a little anecdote about my community work. So a lot of people, because they don't have a family history, they have a healthy lifestyle, they might look at some of these symptoms and they don't, they don't think they apply to them. They feel that they're not at risk. And that's one of the biggest myths that we have in the community and why it's so hard to convince women to start getting screened early and to take charge of their breast health. So we have to kind of think about these in a positive way of, how can we make healthy lifestyle choices to contradict some of the factors that we can't control. Okay. There are some lifestyle choices that we can make to reduce some of these factors. So now I'm going to go through a couple of them so we can kind of look at what we're talking about. So the biggest one is family history. So when you think about family history, think about both sides, your mother's and your father's side. And most family history, usually you do put your family at danger if it's your close relatives. So only 10 to 15% 10 to 15% of all breast cancers are associated with family history. So what we do recommend that, let's say that you got breast cancer when you were 40, maybe your children, your daughters start getting tested 10 years before you did. So maybe they get their first MRI when they're 30. And this is a way to prevent the disease from moving forward. This is a little different than the genetic mutation. This is more, who is in your lineage and who has been impacted by breast cancer and other cousin cancers, I call them, like prostate, ovarian. So we have to think about that. The other one is dense breasts. So as you saw, there's a lot of fat in our breasts. And what happens is sometimes when they do mammograms, they can't really get a clear picture of your breast because of the density. So you might get a letter in the mail that says, we would like to bring you back for an ultrasound, a diagnostic mammogram, so they could get a better picture of your breast to make sure that they rule out any type of breast cancer. Okay. And breast cancer definitely associated with your period. So, when you get how old you were when you got your period, if you have if you have children, when you get your menopause. So those are some of the factors that we should be aware of, and that you can't control. And now we have to think. We'll go back to working with our healthy lifestyle so we can figure out how to reduce our risk of breast cancer. But our recommendations to get screened is that, you talk to your doctor and you really analyze what are your risks. When should you get screened? We do recommend that you start getting mammograms at age 40 if you're at average risk, and that you have a clinical breast exam every 3 years starting at age 20. And a really cool tool that we have on our national website is that we have a reminder of when to get your annual mammogram. A lot of women kind of, maybe schedule it around their birthdays so they don't forget to get their mammogram annually. So that might be a good way, but you also could get this yearly reminder of when to get screened. And I just want to clarify that there are different screening guidelines, and you've seen a couple that are being published, like the USPS task force, and they recommend getting mammograms starting age 50. And our position is that all women should have access to screening mammograms when they and their providers decide that it's the right time for them to get screened, and based on their risk and preference. And we haven't changed our messaging. We really want to empower you to talk to your providers to get screened early. Ask for MRI if you're at high risk due to your family history, and really be empowered to take charge and to work with your insurance and other providers to get that mammogram. We're still very concerned because there's communities here locally in Orange County, like the Latino community, that are not getting screening mammograms. And why the disparities are so high for them is because we find that cancer when it's too late, when it already is at a stage 4 or it has metastasized. So we know that mammograms are machines and they're not 100%, but currently they are the best way to diagnose breast cancer. Okay, so now we want to talk about, what is normal for you? Know how your breasts look and feel, and report changes to your healthcare provider. And this is part of you knowing your body, but also to empower you to report these changes to your providers. We want to make sure that you have that dialogue and that you're comfortable sharing some of your family history, some of your health behaviors, so you can make sure that we get you in as soon as possible. Okay. So overall, the cancer community has done a great job of informing women that a lump in her breast could be associated with breast cancer and advising them to seek counsel for their health. However, there are other signs of breast cancer that women also need to be aware of. We worked with a medical illustrator a few years ago to develop these images. So I'll try to show you what they are, but just remember that there's different types of breast cancers. There's different signs of breast cancer. So I want to kind of go through some of the big ones that we have observed that will require you to have that dialogue with your provider and make sure that they rule out any type of danger of breast cancer. Okay, so here are some things that you should look at. So the first one is the lump, hard knot, or thickening inside the breast or underarm area. Not all lumps are cancerous, but we do want to get them evaluated. The swelling, warmth, redness, or darkening of the breast. A rare and aggressive form of breast cancer called inflammatory breast cancer can look like an infection. So we have to be very cautious of these signs and symptoms. And there may not be a lump present. Often these changes seem to appear overnight. And I can personally tell you that I've gotten some calls, a couple calls through my 10 years at Komen, where women call me and they say, I woke up today and I feel my breasts are burning. They're swollen up. So it's just this sensation that they feel, and it might come overnight. It might be a few days that they feel this. So really try to empower them and link them to that screening mammogram to make sure that, it's not an infection, that we rule out it being breast cancer. A change in size of the shape of the breast. Many women have one breast that is slightly larger than the other, and that is completely normal for them. But we're talking about a change where it's overnight. So the next morning you wake up and it's an obvious change in the size of your breast. So just make sure that you know that that's not normal and that you should talk to your provider. And the last one here is the dimpling or puckering of the skin, which is basically like if you have a dimple in your face that appears out of nowhere, or if you have an apple and when it starts to get rotten, you see that it kind of develops this little hole within the skin. So that's not normal either. Okay. An itchy, scaly, sore rash on the nipple. An unusual type of breast cancer forms under the nipple and erupts at the nipple and may look like a sore rash or an insect bite. So just make sure that you notice those things. So it could be tricky sometimes to figure out what is normal. But this might be a sign of another rare type of breast cancer called Paget's disease of the nipple. So just be very cautious of those signs. The pulling in of your nipple or other parts of the breast. Again, some women have retracted nipples, so that's normal for them. But what we're talking about is that if you notice that all of a sudden your nipple is inverted, that's not normal, you get that gut in your stomach, please talk to your providers. And finally, we'll talk about nipple discharge that starts suddenly. We're talking about a spontaneous nipple discharge. People might find in their clothing or their stain. Of particular concern is discharge that comes from only one breast that is clear or bloody in color. So if you're not breastfeeding, nothing should be coming out of your breast. And finally, a new pain in one spot that doesn't go away. So now we know that breast cancer a lot of times doesn't hurt. And that's why maybe, you could have it in your body for many years and you don't feel any pain or any sensation until you reach 40 and you get your mammogram. However, the pain that we're talking about is that it doesn't go away. Now it's interfering with your regular sleeping pattern, your routine. So please go to the doctor if that pain arises, and talk to your doctors. Okay. And one of the biggest changes as a company is that we did some research and we found some studies that noted that breast self-exams, maybe you use it as a personal tool for your evaluation, but our company, what we really emphasize is breast self-awareness, making sure that you know all these 4 key messaging, and that you look at yourself daily to see if there's any changes and you're empowered to talk to your providers. So as an organization, we prefer to focus our outreach efforts on key messages, know what is normal for you, the changes, and we do not support any promotion or instruction of breast self-exam. So that is a personal choice, but we really do want to validate that there's different types of breast cancer, different signs and symptoms like the ones we have discussed today. Make healthy lifestyle choices. So this is a big one, and it's something that, when we look at the risk factors, these are things that we can control, or at least that we could play a part in improving our overall health. And not just thinking about breast cancer, but all the other diseases that come with weight gain. So we have talked about most of these already, but maintain a healthy weight. Numerous studies have linked body weight to breast cancer risk. However, the manner in which weight affects risk factors between pre and postmenopausal women is different. So before menopause, being somewhat overweight appears to decrease a woman's risk of getting breast cancer. After menopause, however, being overweight increases the risk of the disease by 30 to 60%, depending on the degree. The relationship can be explained mainly by the fact that fat tissue contains an enzyme called aromatase that converts hormones called androgens, made mostly in the adrenal glands, to estrogens. And this extra estrogen can increase breast cancer risk. It is important to note that even though being overweight seems protective in premenopausal women, weight gain should still be avoided. Nearly 80% of breast cancers occur in postmenopausal women, and any weight a woman puts on before menopause will likely be carried into postmenopausal years. In two very large studies, women were at an increased risk of developing postmenopausal breast cancer if they had gained 20 or more pounds since age 18. So we do recommend physical activity, and research shows exercise can reduce the risk of breast cancer in both premenopausal and postmenopausal women. Okay, so at least try to get your 30 minutes in every day of a walk. Another big factor is the use of alcohol. So alcohol in many studies has shown that the risk of breast cancer increases with alcohol intake. The risk is greater than more alcohol consumed. So we do recommend that you limit your alcohol. Maybe you do a social interaction, but there is a correlation between alcohol and breast cancer. Another thing is postmenopausal hormones, specifically estrogen plus progestin, has been linked to increased breast cancer risk. So just make sure that if you are going to take hormones after your menopause, that you talk to the provider. Maybe you get a low dosage, but that is a conversation that you should have, because we do know that estrogen does increase your chances of breast cancer. We do also recommend breastfeeding. So we want to, we want to encourage breastfeeding because it appears to lower the risk of both estrogen receptor positive and estrogen receptor negative tumors. That's another thing that we could work on as a healthy lifestyle. Okay, so now we're going to get to diagnosis and staging. So how do we figure out the types of breast cancer and, how it is diagnosed when you do have a lump or any type of the signs and symptoms that we talked about. So first, it is important to know that not all breast cancer is alike. We refer to breast cancer as being in a family of diseases. There are different types that may start in different areas of the breast, grow at different rates, and have unique characteristics, just as the person herself or himself. A biopsy is required to make a diagnosis of breast cancer. Some biopsies can be done with just a needle to take a sample of tissue or cells, and some are done in the operating rooms as surgical procedures. The biopsy is required to confirm that a suspicious area is breast cancer, and then get to the specific information about the tumor. The information is recorded on a pathology report, and it gives information about the prognosis or the outcome, and it guides the treatment recommendations. So based on what the pathology sees is what your oncologist will use to make some treatment recommendations. Okay, so now we're gonna go into some breast cancer terms. So I'm gonna animate my slide so you can kind of see the changes. So there are several types of breast cancer tumors. These tumors describe where in the breast the tumor started and how early tumors were discovered. In situ means in place. These abnormal cells that grow inside the lobules or milk ducts, but the abnormal cells that grow inside the lobules or the milk ducts, but have not spread to the surrounding tissue or beyond, is called in situ cancers. DCIS, ductal carcinoma in situ, LCIS, lobular carcinoma in situ. Okay, so DCIS is a non-invasive cancer. If left untreated, it is estimated that about 50% of DCIS will progress to invasive cancer. In the past, LCIS was not considered to be a precursor, a condition that can develop into breast cancer. However, recent evidence shows that LCIS may develop into invasive lobular cancer. Invasive breast cancer develops when abnormal cells from the lobules or the ducts breaks into the surrounding breast tissue. Tumors with cells that have spread or infiltrated or invaded into the surrounding tissue are called invasive carcinomas. Most breast cancers, about 50 to 75%, occur in the milk ducts of the breast. The breast cancer is called invasive ductal carcinoma. A second but least common form of breast cancer occurs in the lobules, about 10 to 15%. This breast cancer is called invasive lobular carcinoma. Invasive breast cancer, regardless of where it starts, opens the opportunity for a cancer to spread to the lymph nodes, called regional disease, and then spread to other organs like the liver, the lungs, the bones, and the brain in the process of metastasis. This cancer is sometimes described as advanced or stage 4 breast cancer. It should be noted that invasive breast cancer is not the same as metastasis. And there's other types of invasive breast cancers that we're going to cover briefly. So there are many ways to describe breast cancer, such as where in the breast they start, so the ducts or the lobules, how advanced they are, non-invasive, invasive, metastatic, how they look in the lab according to the pathologist, the presence or absence of 3 biomarkers, and how they present clinically. This slide shows examples of types of invasive breast cancers. For instance, Municious papillary and tubular carcinomas together account for 5% of breast cancers, of invasive breast cancers, are noted for their good prognosis. The names describes how they look under a microscope to a pathologist. However, the 3 listed in the second column behave somewhat differently and may also be present in unique signs and symptoms of breast cancer. We already talked about inflammatory breast cancer as a rare and aggressive form of breast cancer, accounting for 1 to 5% of breast cancer. Unlike the other more common forms of breast cancer, it often lacks a tumor or a lump. It grows in sheets or nests that spread throughout the breast. Clinically, because of no lump is present, it can be hard to diagnose. Its main symptoms are swelling and redness of the breast, and it's often mistaken for mastitis or an infection. It may not be detected by a mammogram or an ultrasound. If symptoms are present, treated and antibiotics for if symptoms are present, treated with antibiotics for an infection and last longer than a week, insist on a biopsy to get a second opinion. So this is a very deadly disease. We see a lot of our African-American women who get inflammatory disease. So we want to empower all of us and any women to really talk to their provider if they have any of these signs and symptoms. Another very common one, another one is pageant disease of the breast. It's very rare. It forms around the nipple. So a tumor grows from underneath the nipple and then it breaks out onto the outside of the nipple. So you feel a lot of itching, burning, redness, scaling of the skin in the nipple area. Sometimes you get bloody discharge from the nipple or flattening of the nipple may occur. So pageant can be associated with either in situ or invasive cancers. All of these cancers can be found in men, and that's the key, that men get very similar signs and symptoms of breast cancer. In fact, pageant disease is one of the most common breast cancers found in men. So we need to talk to our men and make sure, especially if there's a BRCA mutation, that they take charge of their breast health, that they're aware that they're at risk. And even though it's very low numbers, it will impact breast cancer. And you've had a couple of examples of men like Beyonce's dad who got breast cancer and made it a public thing as an awareness campaign. And another very deadly type of breast cancer is triple negative breast cancer. So about 10 to 15% of breast cancer are triple negative. They lack 3 proteins that are targets for treatment. They are basal-like tumors. They're often aggressive. They have a poor prognosis because of the lack of targeted treatments. They're more common among premenopausal African-American women, and they're associated with the BRCA1 and BRCA2 mutations. So if we look at breast cancer and disparities amongst the different groups, as a national group, African-American women are at higher risk, almost 40% higher risk of dying from breast cancer compared to, their white counterparts. So we need to really, make sure that when we're working with the different communities that we are culturally appropriate and we figure out, what is the best breast approach to reach these populations, and what messaging and what resources are needed for each individual community. Okay, so now we're going to talk about some breast cancer treatment. So the goal of treating breast cancer is not to get rid of the cancer as completely as possible and to prevent it. And so the goal is to try to get rid of it and prevent it from returning. This is usually done with a combination of surgeries, radiation, chemotherapy, hormonal, and targeted therapies. There are different types of breast cancers also shown on the so as we, if, sorry. There are different types of breast cancers as shown on the previous slide. In addition, every woman is unique. For these reasons, there are different ways of treating breast cancer. Local treatments are designed to remove cancer from a limited local area such as the breast, chest wall, lymph nodes, and the armpit to make sure it does not reoccur, come back in that area. Local treatments are surgery, lumpectomy, mastectomy, with or without reconstruction, and radiation. Systemic treatments aims to get rid of the cancer cells that may have spread from the breast to other parts of the body. These include treatments such as chemotherapy, hormone therapy, targeted therapy. So treatment could include a combination of two or more. Again, the most important message is that the earlier breast cancer is found, the more options and the more effective treatment is likely to be. In the past, treatment decisions were made based on the stage of the tumor, which is closely related to the size and the extent of the tumor spread. However, today, while size and extent of tumor spread are still important, treatment decisions are being made on the molecular characteristics of the tumor itself. So treatment is personalized based on the tumor itself. So this just tells you how advanced we are. We went from radical mastectomies in the 70s to now having personalized options. Not everyone has to get chemotherapy. So it's really making sure that you're comfortable talking to your doctor and also to your care team. Oncology nurse navigators are fabulous. They can answer your questions. So just make sure that you have your dialogue. And if you need a second opinion, that you're empowered to also take charge of your breast health. And now we want to go to another very important topic, which is clinical trials. How do we find the cure? How do we find advances in treatment and even technology, right? Maybe one day we'll have a machine that's not painful. Maybe breast cancer will be diagnosed through, a blood type or something in our genes. So just want to make sure that we encourage people to participate in clinical trials. And as we know, a lot of the ethnic minority communities are hesitant. There's a lot of history of mistrust in some communities. So we have to do a better job of really understanding what is a clinical trial? Why are they so important to really getting us to the next phase? And we're very fortunate at Komen that we do have a clinical trials information hotline. We work with the breastcancertrials.org. So we will try to navigate you to find a local trial or even a national trial that you might participate in. But we need to figure out, how to encourage our communities to participate in order to find the best and greatest advances that are going to impact our overall community health. And, breast cancer, it doesn't only impact the patient, it impacts the whole family. And I think that a lot of us, even as professionals, if we work at a clinic, if we work at a hospital, if, one of our relatives or friends, we can really be that emotional support system. And just know that there's a lot of support groups, a lot of resources out there to help you cope with the disease. And, we recommend that, the person who's going through it and maybe their family members should seek some counseling or some ways of coping with the disease, and just making sure that, co-survivors are aware of the resources, and that, we could all be co-survivors to someone who's going through the disease. And now we're going to talk about what are our resources. So, our Orange County affiliate, we're very proud of our wig salon. So if you know of anybody who needs a wig right now, we're currently mailing wigs. So it's been great that even despite of COVID, we have been able to help over 30 women get wigs. We also have our partner Breast Cancer Solutions, who's helping us, provide that financial assistance. We have a list of support groups and some great breast cancer survivor thrivers and mentors and who volunteer their time. So please reach out to our local affiliate if you need any help. We also can connect you to diagnostic services, screening services. We do work with our community clinic partners to make sure that there's a breast navigator that can assist you with any of your concerns, and that can link you to some of the safety net programs that might cover your mammograms, and your breast cancer treatment if needed. So please call us. We want to be a resource to all of you. And we also want to encourage you to call our national helpline. So our national helpline has experts, so a lot of, social workers, maybe nurse navigators who could answer some of those deeper questions. Maybe it might be about treatment or it might have additional resources. There is also national financial assistance through a hotline. So we do recommend that you call. There's different languages and that could be an additional resource, but locally here we do have our mission team. So feel free to call us. Okay, so now, I hope you learned something, and if there's any questions, if you want to put them in the chat or ask. Let me see. Okay, now I can see you. So I just wanted to see if there's any questions from anyone. And you could also unmute and you could ask me. So that would be great if you want to just unmute your microphones and if you have any questions to ask. And feel free to reach out to me if you would like a copy of the presentation. I would gladly email it to you. And it has my notes. So that way, if you are doing a community presentation or you want more of that additional information, I will gladly share that with all of you. Okay, so it seems like we have no questions. So thank you all for participating. And have a great day. And please reach out to our affiliate if you have any follow-up questions that come to mind or you want to have a personal conversation with me. I'm always here to listen. So thank you.